Now it's time for tip-episodes with quick tips you should know. Techniques you can implement into your workflow right here on A Tale. A Tale, oh yeah. A Tale of Two Hygienists.
All right, listeners, welcome to this week's tip episode, joined today by Danielle and Laura. Thanks again for being with us.
Thank you. Thanks for having us, Andrew.
So here's the thing that we just had, we have a study club, and we had a periodontist. She was speaking about when to refer to the perio specialty. And I feel like a large part of my career, I was in a situation where weirdly we didn't see a lot of perio. I think it was definitely a younger demographic, highly educated demographic. It was just, and when there was like, there's more decay and more like rampant caries in that community versus perio. And then I went to another community where it's like all perio and like not as much decay. It's very weird at the pockets that I've worked in. And so I feel like for the people who started their career and maybe didn't have a lot of experience of like, when do we refer to perio? This study club that we did was super helpful. But then I was like, that's really nice. Let me bring on two people that are just like normal, everyday, like regular people, schmoes, and like, well, let's see if they know about like when did they refer, and then is that the common knowledge? So let's start with the baseline. Like, what is your protocol for like? I can't let I call you guys schmoes. I the protocol for like when do you do the assessment, and then at what point are you referring out?
Okay, I love this. So I think obviously we should be doing assessments for our patients every single time. Assessments are so important and we need to see where they're at because whether we saw our patient 3 months ago, 4 months ago, 6 months ago, things change. They could, all of a sudden have heart disease or diabetes, or they could be severely depressed. A lot can happen in that time frame. So assessments are very important where we want to see where they were to where they are now. With that said, if I've had a periodontal patient and I have treated them, say a patient's presenting with 5, 6 millimeter bleeding pockets, I'm going to treatment plan periotherapy, do laser assisted periodontal therapy, apply oral probiotics, send them home with some OraCare mouth rinse, all my tools that I have. And then they're coming back and they're still not responsive to them, then we discuss that further. To answer it, if I have a patient that has when we could also refer, I would say recession, mobility, furcation involvements, things like that. Danielle, chime in.
Yeah, no, I 1,000% agree with what you're saying. If a patient is non-responsive and we've utilized all of our tools, our perioprotect trays, our salivary diagnostics,
Mhm.
and they're still having, those 6, 7 millimeter pockets that are not responsive, then from there, I say, sure, let's refer them to the specialist and see if there is something else going on.
Let me flip this on its head a little bit because I would put a lot of money on the fact that you all are very much more well equipped with the OraCares, the Paraprotect trays, and all those different things than the standard office is, right? I think that you also have a level of maybe knowledge that, sorry, I'm not trying to throw the rest of the hygiene community under the bus, but like you guys live, breathe, like you teach this world to people for the everyday middle of nowhere, practice that's not having all of these tools. When might they refer that's different than when you refer?
Great question. So for me, I would say let's go back 10 years. That hygienist that I was 10 years ago, when would I refer? I would refer 5, 6 millimeter pockets because the doctor wasn't allowing me to do periotherapy. So that's when I would refer to the perio specialist. A hygienist that's doing periotherapy, I would say do the treatment, do the scaling and replaning treatment, and have the patient back for that reassessment. And if they're not responding, refer.
I like that approach too. The way we've always couched it was like, you do the initial therapy as much as you can because you don't want to send a completely diseased patient for their full dentition to the periodontist because there's a lot of work that they don't actually need to be doing at the perispecialty. And it's nice to have that baseline of like what's going to respond, what's not going to respond. And I think that actually gives the periodontist actually a lot of information. It gives them like an immune response, like baseline, like, hey, this is what they could do if they could get this, this particular part under control. I think there's just a lot of data that they can kind of compile there. Laura, you mentioned earlier recession, mobility, furcation involvement, things like that. What about like lip tie, tongue tie? What about some other things that you might be looking at?
Yeah, definitely lip tie, tongue tie, absolutely. Then I'd be talking to them about myofunctional therapy, but that could be a whole other podcast. Um, I think when you're looking at recession, you want to evaluate the clinical attachment loss. If they don't have that attached tissue, you want to get them to the specialist sooner. So it increases the chance of them saving the tooth. If they're really the furcations involved, yeah, absolutely. Give that referral. At the end of the day, I don't think that you're in the wrong if you refer to the specialist if you're in doubt. And if you're questioning something, I don't know, at that point, go with your gut.
At what point do you feel like they might want to start doubting a little bit? So let's take recession just as a kind of a, I don't know, easy one. Is it when the patient has 1.5 millimeters of recession, when they have 2 millimeters? Like, at what point are you saying, "Hey, look, there are some treatment options to get this area addressed, so you don't have root exposure,"
Mhm.
which would maybe not right now be an issue, but in the future, you don't want to be susceptible to caries on your roots. I mean, do you guys have a baseline of like when you start to get a little bit nervous about that, even if it's controlled and stabilized recession?
Yeah, I think that's a great question.
I think obviously it depends on the patient. I've had patients, if they have a greater attachment loss of 5 millimeters or more, you definitely want to be getting them to the periodontist to evaluate, or even 3 to 4 millimeters if you're seeing that in multiple areas and you could save that tooth, give them the referral. Danielle, anything that you want to?
Yeah, no, I literally was same. Like it just is patient dependent, how much attachment loss there is, 4 or 5 millimeters, and you're just seeing that there's starting to be that bony defect there. Refer to the periodontist for sure. And like Laura said, there's never a bad time. Like if you're doubting or unsure, uncertain, and you're questioning, ask people that do know, or give that referral because you're just helping the patient. You know what I mean? There's not a bad time to refer to the periodontist.
Well, and I think that kind of ties into like the last question is I felt like earlier in my career, Daniel, you mentioned, the 10 years ago, 10 years ago, Andrew also, I mean, it was part of our protocol, but I mean, we never referred out to the specialist. And I'm just thinking about like, I have pictures of people's teeth. Not, I don't remember their faces, but you remember their teeth, right? And so it's like, I have arches that I'm just like, why didn't I ever send that referral? Why didn't I push harder? Why didn't I advocate harder? So do you feel like hygienists could refer more, or do you think that we're doing a decent job?
Yeah, I think that when you know better, you do better. And the Andrew and the Danielle 10 years ago didn't know better. And now that we know better, we would refer more. And I think that again, it ties back into the tools you have in your toolbox. Every hygienist has different tools. And so once you've maxed out your toolbox, then refer. And there's no harm in referring. And sometimes even before you've tapped out that toolbox, maybe the referral is necessary for other reasons.
Mhm. Well, I want to thank you both for being on today. I think this is really helpful. I think and one last just piece of advice for the listeners, like you got to find a specialist to partner with. If your office doesn't already have one, you have to go to like the study clubs and things like you just find someone that's really engaged in the profession, that loves the profession like we all do, because that's going to be the person that you're going to want taking care of your patients. And so that you guys will have a healthy relationship with them. Danielle, Laura, thank you so much for being here. If people wanted to find out what y'all are up to, how can they find you?
They could find us on Instagram at Diamond Girls Coaching. They could also check out our website. It's www.ldiamantcoaching.com. And our email address is on there with the rest of our contact information. We're here to help and
Awesome.
support.
I'll put that in the show notes. Thanks so much.
Thank
Thanks,
you.
Andrew.
A tale of two hygienists.